Next is the arytenoid cartilage. In the previous section, I have discussed about the thyroid and the cricoid cartilage and the epiglottis, and now it is the arytenoid cartilage. What is the arytenoid cartilage? This is the pyramid-shaped cartilage, and there is the three surfaces of this cartilage. The base, there is the base, and next is the apex. There is the base, and next is the apex, and there is the medial surface and the anterolateral surface. The medial surface and the anterolateral surface. That is the pyramid shaped structure. It is the pyramid shaped. This is the pyramid shaped, and it has the medial surface, and second is the pyramid shaped, and there is the medial surface and the anterolateral surface. The anterolateral surface has the two depression which is separated by the ridge for the muscles, vocalis muscles, and for the ligament attachment. Vocalis muscles and the ligament, that is the vestibular ligament attachment. And the anterior angle of the base of the arytenoid cartilage, it is elongated into a vocal process through which the vocal ligament is attached, and the lateral angle is elongated into a muscular process for the attachment of the posterior and the lateral cricoarytenoid muscles. The concept, that is it is the base. There is a base and the apex. The base and the apex, and they are the pyramid shaped. They are the pyramid shaped, and they have the medial surface, and there is the also the anterolateral surface. Now the next is the corniculate cartilage. What is the corniculate? They are the two small cartilage, cone shaped cartilage, whose base articulates with the apex of the arytenoid cartilage, and their apices project posteromedially towards each other. Posteromedially towards each other. That is the corniculate cartilage. That is the corniculate cartilage. This figure showing the arytenoid cartilage. They have the apex. They have the apex and the base. The base and the apex. From the apex, there is the attachment of this corniculate cartilage, and this figure showing the also the cuneiform cartilage. This is the cartilage, that is the arytenoid cartilage and the corniculate and the cuneiform cartilage. The arytenoid, the corniculate, and the cuneiform. Cuneiform cartilage, these are the small club-shaped cartilage, lies anterior to corniculate and suspended in the part of the fibroelastic membrane of the larynx that attaches the arytenoid cartilage to the lateral margin of the epiglottis. That is a fibroelastic membrane. It is suspended in the fibroelastic membrane, and this fibroelastic membrane attaches to the arytenoid cartilage to the epiglottis. This figure is again showing the arytenoid cartilage and the surfaces of the arytenoid cartilage, the medial surface and the anterolateral surface, and there is the facet present in this cartilage for the corniculate cartilage. Next is the ligament, that is the extrinsic ligament and the intrinsic ligament of the larynx. Extrinsic ligament, what are the extrinsic ligament? That is the thyroid membrane. It is a tough membrane, the tough fibroelastic ligament that spans between the superior margin of the thyroid cartilage and below and hyoid bone above. That is the thyroid membrane. And aperture in the lateral part on each side is for the nerve, artery, and the lymphatics. That is the extrinsic, the thyroid membrane. Next is the hyoepiglottic ligament, and third is the cricotracheal. Hyoepiglottic ligament extends from the epiglottis to the body of the hyoid bone, and cricotracheal ligament, it runs from the lower border of the cricoid cartilage to the adjacent upper border of the first trachea.